Good morning, Lake Providence Church family and friends. Welcome to another health ministry update. I'm Dr. Linda Plummer Ward. Last week we talked about the purpose of vaccines to promote herd immunity or immunity throughout the population so that the virus can't continue to transmit and spread person to person. Now, besides wearing masks, washing our hands, and watching our distance, this is another long-term way that we can actually slow the spread of the disease. Vaccines also stimulate our bodies to mount an immune response and make antibodies without us actually having to have the infection. So that's a good thing. Even though we can get a sore arm, fever, chills, body aches, for the first 24 to 48 hours, and some of us don't get those things, but those symptoms are actually a reaction that tell us that our immune system is working and that our bodies are doing its job. This is a much more desirable thing than having to have the disease and the consequences that can occur with that. Right now, we know that Pfizer and Moderna vaccines are 95% effective, but their efficacy has to do with preventing severe disease and death. We don't really know if they are able to stop asymptomatic disease or transmission and spread of asymptomatic disease. Those studies are still in progress. We know that the virus is mutating or changing its genetic makeup so that it can more easily infect us all the time. Vaccines are designed for many strains of a virus, not just one. Scientists continue to study the genotype or the genetic makeup of the strains, and it's believed that the mutations thus far are covered by the present vaccines. More research will be needed with that, but there's no reason to doubt it at this point. So what do you do if you test positive? The first thing is to isolate yourself for a minimum of 10 days from everyone according to CDC guidelines. Take note of when you think you were exposed and when you had a test that was positive. That may make a difference in your eligibility for certain treatments if you have to be admitted to the hospital. Get a pulse oximeter because your oxygen saturation or your level of oxygen will be very important in determining when you need to go to the hospital. If you have an oxygen level below 90% or below, you should go to the hospital. If you're feeling unusually short of breath, regardless, you should go to the hospital. You may be familiar with a procedure called proning, where you lay on your stomach to breathe, because we have so much more lung capacity in our backs than we do in our stomach, in the front rather. So when you take a deep breath and you're laying on your stomach, you actually get more air in because you have more area in your back to get more air in and exchange the air. So if you're able to do this, great. But regardless, if your oxygen saturation is 90% or lower, if you're feeling unusually short of breath, you need to go and be evaluated. You may be familiar also with the supplements that are said to boost our immunity. We're not absolutely sure that they boost our immunity, but it definitely is not harmful. It doesn't hurt to try. So, vitamin C, vitamin D, and zinc. You can talk with your physician or your pharmacist, but you can try those to help your immune system to work at its best. Fluids to keep hydrated are very important, more important even than eating. A lot of people don't eat as much, but you have to stay hydrated. And remember, if you have a fever, it's going to require more water, a minimum of 6 glasses of water, again, more if there's fever. 7 hours or more of sleep, and sleep that starts before midnight is important because our bodies need the rest in order to fight and in order to repair. If you develop chest pain, a swollen leg, a weird rash, vomiting or diarrhea, anything that is questionable to you, get checked. Don't wait at home. You need to be evaluated. When the vaccines came out, we also got the scam artists. So they want your money. The vaccine is free. Your provider may charge to give the shot, but the vaccine is free. Be careful of the sites that you're on. If you're going to go on a site to get an appointment, be careful of who you're talking with on the phone. It may be better for you to call yourself or go to the site yourself rather than have someone send you information. One of the sites that's an official Tennessee site is covid19.tn.gov. You'll find a lot of information there, including the governor's eligibility tool, which allows you to make appointments. And at this point, you would be put on a waiting list. You can also check the LPMBC Nashville Health Facebook page, which has a good deal of this information also. From the LPMBC Health Ministry to each of you, one of my favorite verses, 3 John, 1st chapter, 2nd verse. Beloved, I wish above all things that thou mayest prosper and be in health, even as thy soul prospereth. Remember, stay connected. And as always, stay safe, stay healthy, and stay prayed up. Bless you.